Hi, my name is Ashley Waggoner, and my poster is on the effects of muscular fatigue on EMG amplitude in isometric forearm flexor and extensor contraction. Previous studies have shown that as muscles fatigue, surface or SEMG amplitude increases while voluntary muscle force decreases during both maximal and submaximal contraction. Increases in SEMG amplitude likely reflect increased recruitment of motor units, which may combat fatigue effects of individual motor units firing more slowly. The question this study was looking to address was, what is the relationship of muscular fatigue to percent maximum voluntary contraction, or MVC amplitude, of forearm flexors and extensors? The hypothesis was that as muscular fatigue increases, percent MVC will increase due to increased motor unit recruitment. Subjects for this study were 8 DPT students at Regis University. EMG electrodes were placed on each subject's forearm extensors and flexors on their dominant side. The subjects first performed an MVC using a hand grip force dynamometer in the standard position seen in Figure 1. Maximum amplitude of EMG readings for flexors and extensors were recorded during this contraction. Maximum force produced was also recorded from the dynamometer. The subjects then held the dynamometer at 25% of their recorded maximum force for as long as possible, and recordings were taken of flexor and extensor EMG amplitude every 15 seconds. Once the subject reached fatigue, the measurement period ended. Amplitude data for each time period were divided by MVC amplitude to calculate percent MVC, which could then be compared between subjects. Mean and standard deviation for each time period is displayed in the figures for both extensor percent MVC on the left and flexor percent MVC on the right. These graphs show a trend of amplitude increasing with fatiguing contraction for both flexors and extensors. Standard deviation, however, is very high for almost all of the time periods, so no clear conclusions can be drawn from our data. As subjects reached task fatigue at 300 seconds and beyond, they no longer contributed data, which explains the decrease in standard deviation seen at later time points. Other studies have shown that high inter-subject variability occurs in SEMG amplitude, so the high standard deviation in this study could be a result of the subjects' varying levels of forearm strength causing them to reach fatigue at different times. Further sources of error include issues with EMG functionality during data collection and the inexperience of most of the researchers with using EMG. Since motor neurons are lost with age, a shorter observed time to fatigue in an older patient in the clinic could be explained by an inability to rely on increased motor unit recruitment. Percent MVC compared with time could be used to help determine what duration and level of exercise these patients can safely perform. Thank you very much for your time.